this same Palantir program, Gotham AI kill chain, is being used to target Hamas in Gaza and Palestine. And they already have the technology here in America. They've already used the Tiberius and Gotham AI kill chain in America to create a risk score and then detonate the countermeasure. So, I mean, all of the technology is in place. I mean, it's really just a matter of deciding, okay, well, now's the false flag. We're ready to go.
You're listening to the Corbett Report.
Welcome, friends. James Corbett here, CorbettReport.com, in an interview that is being recorded on June 17th, 2025 here in Japan. But I am talking on the line today to a guest from the United States, specifically Zowe Smith, who is the author of, well, My Life in the Thrill Kill Medical Cult, the Substack. She also has a book on the COVID code about the Thrill Kill Medical Cult and her interesting experience having, well, seen the bureaucratic back end of the COVID-19 scamdemic. Very interesting stuff. Today, we're going to be delving into the heart of medical surveillance generally, but genomic surveillance particularly, and creepily enough, for the Gattaca-like world we are goose-stepping our way into. So let's find out all the grisly details from Zowe Smith. Zowe, thank you very much for joining us today.
Hi, thanks for having me on, James. Yeah, happy to be here. Where should I start?
Excellent. All right, let's start by talking about your own personal experience and background, because as I say, you have an interesting bureaucratic sort of back-end view of the scamdemic that most people don't even know probably exists. Specifically, you worked in the medical coding industry, which is something that most people probably dimly are aware of its existence. So tell us about that.
Yes, most people are hardly aware that medical coding even exists in most countries. All countries have it. Any member state of the WHO has coding for all their medical, any sort of medical service that you can seek and acquire. There is a code that goes with that, a procedure code, a diagnosis code. In countries other than America, it is all collected for basically disease surveillance purposes. So like how they know how many cases of cancer there are across the world and which cases of cancer and how many cases of heart failure and diabetes. So they know, which pandemic is going to kill us tomorrow. That's basically the purpose of the code system, is to have a statistical database that or a way to aggregate all of that information so that they can monitor diseases and see the prevalence. In America, it is tied to payment. So every claim, every time you go and see a doctor, every intervention you have, even if it's just a lab test or an x-ray, there's a code and it gets sent to insurance. And then that's what insurance uses to pay the claim. I've even been told that in other countries, that's how their system is pretty much built up. Their payment is based on the same things. It's just not billed through the coding system in the same way. So that's what a medical coder is.
All right. So how did then that lead to the falling down the rabbit hole of what you saw with regards to COVID-19? What was taking place during the so-called pandemic that was different than what you'd experienced before?
Pretty much everything. So I had been through swine flu and MERS, and what was the other one? There was one other pandemic around the 2000s, not swine flu, the other H1N1 disease in the hospitals. I'd worked in the lab before I was a medical coder, so I have 15 years of hospital experience in various fields. And there wasn't really a pandemic or a scare, really. And I've even spoken to people in the ER, physicians, techs that have worked in the ER over these things and COVID, and they all say that there really wasn't a pandemic going on. It was just a scare. So when we got told, hey, there's a Wuhan virus coming from China, which we were told in November of 2019, I thought this is just going to be another same thing. But then they started calling 2 weeks to flatten the curve and, shutting everything down, shutting our hospitals down. And the big thing that tipped me off that I'd like to emphasize today is the contact tracing. So there were a lot of things that tipped me off, but that was a very big red flag that continues on today in what I uncovered, what was going on with it. So contact tracing, as we all know, came about because of the pandemic. And that started fairly early on. I think even before 2 weeks to flatten the curve, they were already doing contact tracing. And in the hospital, we had done something similar to that for HIV for many, many years before that. But we never collected all of the information on all of the contacts of the people with HIV. I think the social worker or the person taking an intake form for anyone taking an HIV test, that information had to be sent to a registry for national, international disease surveillance purposes. That AIDS was something that there was a registry for, and that's something that we would track. So I thought that COVID, they're creating a registry for COVID, and they were putting this contact tracing information into this registry for COVID so that they could monitor all of the data points for COVID. But the difference was, and the point of this registry was to collect all of the information, not just who you had come into contact with, which for HIV would have been de-identified information. That information wouldn't have gone into the database. It would have just been, you've had a positive HIV test, or you're now diagnosed with AIDS, and then your demographic information. But all of that should have been de-identified by policy before it goes into the registry. For COVID-19, all of that personally identifiable information, that was the point of collecting that. And so I thought, this is a HIPAA, this is a privacy infraction. HIPAA is kind of interesting because it's not really about privacy, it's more about sharing. And it was drafted by Hillary Clinton, which is interesting in and of itself. But the contact tracing part, I realized that is a huge privacy infraction. There were multiple Congress people across the United States that gave warnings about this is privacy infraction. The hospitals at that time weren't too worried about it. They were more than willing to comply. But I felt like this is a huge breach. And then I came across, so for a medical coder, for anyone in health information management, the HIM department, there's a credentialing agency, and it sort of dictates how all of the documentation, how physicians are supposed to meet these documentation criteria. And it's our credentialing agency or our licensing agency. So they have a peer-reviewed journal. And in that journal, I saw for this registry that they were creating for COVID-19, it was going to be a lab testing company called LabCorp and a company called Ciox, which is a data aggregating agency, basically. All they do is collect data and they create a database. And the Ciox portion was brought on so that LabCorp and Ciox could partner to collect all this information, which would then be sent to the registry. Well, going a little bit further down the rabbit hole, the other linchpin of the COVID pandemic was the PCR testing. And being a medical coder, there were official coding guidelines on how to do COVID-19, on how to code COVID-19. And there was a rule for COVID-19 that said, and this is an exception to Section 2H, their normal guidelines for how to assign a diagnosis code. For COVID-19, the physician only the physician's documented medical opinion is sufficient for diagnosis, which is an exception to every other rule. So they didn't have to do a PCR test. But then I noticed that everybody who came in and was given a PCR test, and then we start hearing about the rumors of the false positives that were going out with the PCR test, which never should have been a thing. Having laboratory experience, that means the test doesn't work. There should not be any such thing as a false positive. That means there's some quality control issue with the test, or that the results of the test are not reliable. Any of them, even the ones that are positive, regular positive. That just means that all of the test results are invalid and there's a quality control issue. So I thought nobody needs to take a PCR test. And there's these positive PCR test results. And going back to my laboratory experience, all of the PCR tests that we had done up until when I stopped doing working in the lab and then I went into medical coding, they were all genetic tests. They were genetic screens so that people could see if they could get a genetic screen and see if they should have a baby, like rule out if they have a genetic disease the baby might get, or it could be something where they might have cancer in the family. They want to rule out cancer. So I thought, why is PCR suddenly being used for these COVID tests if they don't need them? And it was always genetic testing. And then I came across a document, and this is really the key to the whole thing, and something that to this day people are not aware of, and I would like more people to be aware of, is there was a document from the CDC that specified that any CLIA certified lab that was running a PCR test had to sequence the sample and send it to one of two gene banks, GISAID or NCBI. And it said that in the documentation. It's right now on the CDC archive. And I'm even a part of a case, a PCR case, which is being censored and silenced and kicked back from the courts, where we're trying to prove that that this PCR fraud is going on and that there's a market for your genetic data. Because if you go to Datavant, and Ciox got bought out by a company called Datavant. So Ciox was the company that was data aggregating all this information that was coming with the PCR tests with LabCorp. And so they got bought out by Datavant, and you go to their database, and it's a public-private partnership now. It got privatized. But that is where this COVID-19 registry now lives. And so that's all your private medical data. That's your genomic data. That's there's over 500 databases in there. So, I mean, they're layering data on top of data, but they want your DNA, they want your medical records data, they want your claims data, and they say right on the database, the purpose of this is not only because they need all this genomic surveillance data to come up with vaccines and new drugs that are designed specifically to the individual genome.
So let's underline this. Let's stop for a moment and just underline the importance of this. So you're saying that everyone in the United States who took a PCR test had their genomic data shipped to one of these two databases, and that this GISAID is now being used by a private company as part of a, genomic surveillance grid that's trying to predict variants of concern for the future? Just spell that out for us again.
Absolutely. Yeah. It's a very tangled web, and I'm still working on untangling all of the pieces of it. So that was one piece of it, was the PCR data was then being sequenced and sent to these gene banks. Now in America, any lab that's CLIA certified, so that's going to be any lab, any hospital lab, any outpatient lab, just those like lab testing centers, they would have all been CLIA certified. So they would have all had to send sequences to these databases as a condition of running the test. So they weren't just running the test and then sending the information as required to the CDC for their statistical monitoring purposes of the diagnosis and the test result, but they were also sending these sequences to the gene banks. Now they're saying that these were just the cut sequences from that were like the spike, or that was the virus part, not the entire genome. But I've spoken with David Rasnick, PhD, who worked with Carrie Mullis, who invented the PCR, and I asked him that specific question, and I showed him the document, and I said, do you think that they're just getting a tiny little sequence of this, the viral portion, or are they getting the entire sequence of DNA? And he said, it's possible that they could just cut a tiny sequence and call that the spike or COVID and then send that. But it was far more likely, because it would take a lot of work for them to do that. And they automatically have to get a sequence in order to run the test. That's part of the process. So they already have that information. It would be really easy for them to just ship it off. They have to use AI to create the sequence to begin with. So it's already digital, and it would be easy for them to send it off. And now they're creating these APIs, which make it easier for hospitals to send that information to the registry. So now they have basically programs that make it easier to talk to the databases.
So it's not only technologically feasible. You're saying there's no illegal. Are you saying there's no legal ramification to this? There's nothing blocking them from doing this?
Not at all. No. The case that I'm a part of, the plaintiff is suing for selling his genetic data without his knowledge or consent. And he has the receipts of who has made the money. The labs, the judges, city members have all profited off of this RICO ring that's going on, selling your genetic data, because that's how valuable it is. There is a market for this. And that's why there were so many. And David Rasnick admitted this in one of my interviews as well, because he had a biotech company and he understands the industry. And he said, yeah, that's what they were doing. They were all popping up and making all this money off the COVID relief fund because they got paid to run these COVID-19 tests to begin with. And then there's a further market on selling the genetic data that they get as a consequence of running the test. And JJ Cooey also is going to testify that PCR, you have to get a genetic sequence as a condition of doing the test. That's just part of it. So you can't say that they weren't getting the genetic sequences. But it gets even deeper. It's not just in America, actually. Karen Kingston uncovered a document from an American intelligence company that said that PCR tests from China companies, they were getting our data. So the Human Genome Project, BGI Genomics, is the biggest biotech company in China, and they sold hundreds of thousands of PCR tests to Americans and other countries. And so as a condition of doing those PCR tests, my money is on, they also have your genetic information through the results of those tests, because you have to report back to the center that you got the test from. That's always how the test works. And right on the BGI database, it also says that we need your massive amounts of genetic information in order to stop COVID-19 and in order to create the next vaccine that will stop the next pandemic, right down to the individual genome. So these databases are the information that people like Larry Ellison are trying to use to create their vaccine that's going to stop cancer. When he says we're going to use AI to do a blood test so we can detect cancer, and then we're going to make a vaccine to your individual genome, this is the genetic data. These are the places that they're using to pull that so that they can develop their, and I'm just going to call it a bioweapon. I'm not even going to call it a vaccine, because given their history and how COVID shots, mRNA shots have worked out, I think that's an accurate description as bioweapon.
So, all right, let's underline what you just said there, talking about Larry Ellison. For people who didn't see, yes, on one of the first days of the new Trump administration, he brought Larry Ellison and Sam Altman and Masayoshi Son in to announce the Stargate project, and asked his good friend Larry Ellison, what kinds of things are you working on with this AI technology? And Larry Ellison specifically talked about developing new mRNA vaccines for cancer and things like that using AI technology. What could go wrong? And for the heart of thinking out there, let's spell out in black and white how this has nothing whatsoever to do with the Coke versus Pepsi shadow play that they put in front of the public, the political nonsense games, that people think that they're making a big decision by voting for Team Coke or Team Pepsi. It means nothing to the functioning of this system, which was set up, started under Trump, obviously with regards to the early part of the scamdemic, continued with Biden, continuing now with Trump too, and Larry Ellison and his friends. This has nothing to do with that. So who are some of the real players in this space? What are some of the companies that you found that people should have their eye on?
Well, there's the big one is Palantir. And that's the name that's coming up with the Trump administration just recently signing contracts and what's going on with ICE. I even uncovered a website called No Tech for ICE, which is a really good website. I recommend to check out. They've got a really good documentary on there on all the connections between Palantir and the programming. So the really interesting thing, and I did 2 articles, like a 2-piece article called Medical Surveillance, where I cover all of this. And in part 2, I talk about how the contact tracing like really evolved into this. So I think there was a program called HHS Protect during Operation Warp Speed. It was part of Operation Warp Speed. That's where I think most of the public-facing infrastructure began. Although I was looking into Operation Stargate, and I'm seeing documentation on CIA databases that say it's more than 10 years in the making. So definitely, it's a planned thing. It didn't just come out with day 2 Trump administration. But so this HHS Protect program is really interesting because what it did, it used 2 different Palantir programs. So the AMA, HHS, the CDC specifically, all partnered with Palantir, and then Palantir developed a program for Operation Warp Speed. And that program, what it did was it assigned people a threat risk score. And then that was a program called Tiberius, which they also use for other purposes. So I want to make this point about AI, because when I was a medical coder, I was using a program which is a partner of Palantir, both 3M and Epic, and those are 2 different programs that I use that both have AI built into them that are partners of Palantir. And so all of these AI databases talk to each other as a condition of working with each other. So this has been going on for a very long time. But within Epic, there are programs, and you can rename them whatever you want. But it's the same program at any hospital across the country. So like your program Epic might not be named Epic at Johns Hopkins or Mayo. It might have a different name at Johns Hopkins or Mayo, but it's still the same program. So this program from Palantir called Tiberius, they can rename that whatever they want, but the program will still do what it was programmed to do. It's just a function, really. And HHS had 2 programs built in. Tiberius was the thing that assigned you a threat risk score, and that was if you were following lockdown criteria, if you were actually distancing from people, if you had been vaccinated, if you were masking, how obedient were you? That was your threat risk score. They also could determine down to the zip code where you were and how compliant areas were. And so as Whitney Webb covers from the Unlimited Hangout, she wrote an article covering this program, HHS Protect, and highlights how this was used to target ethnic groups. So this threat risk score also incorporated your ethnicity, and they thought, you're higher risk if you're certain ethnic groups. So of course that was part of the risk score. And then Gotham is the AI kill chain program created by Palantir. And that was used within HHS Protect to execute. So the Gotham program, it takes the threat risk score from Tiberius, and then it executes the threat, or does an AI decision-making process and decides when and how and where to deploy the countermeasures, which was your vaccine, your remdesivir, and your ventilator. That is why HHS Protect was created, so that they could monitor all of this. And that is how they identified different hospitals or different individual patients based on some algorithm, and determined that's how we're going to execute people with their AI kill chain Gotham program. So Palantir's involvement is incredibly nefarious, I find. And I was tipped off actually when I was still working. One day, I remember we were having IT problems, and I heard, I would get emails and instant messages from my managers sometimes, because I had been friends with them. I had been on management before. And so I got some more information than maybe your average production worker might get. And they said, oh yeah, we're having trouble with sending information. We're having some sort of a cloud issue, or our information won't send. And they were really, really nervous about it because if they didn't get that information to send within a certain period of time, then we wouldn't get our money for any claims from Medicare, which would have bankrupted us like very, very fast within days. So they were sweating bullets over getting this fixed. Come to find out, that was the HHS Protect program that we had to send information, or we would be penalized by Medicare and not make money off of that. Well, and Congress, again, this was the time where healthcare said, we don't want to send this information. This is privacy breach. This is far too much information. We shouldn't have to send you this much information this frequently. But it happened anyway. Medicare pushed for it. The White House pushed for it, saying national security. And it has become mandatory. And that program is now permanent.
All right. So,
and as far as the other players,
let's just imagine for a moment there is somebody out there in the crowd who still is not concerned about this level of surveillance and thinks, well, okay, whatever. There's registries, there's databases, they're tracking, they're assigning scores, whatever. Let's lead this into the obvious connections to, for example, Palantir becoming an AI weapons manufacturer and the ever-present specter of the slaughter-bot future that we're careening towards that cliff. Let's connect those dots and talk about how this type of genomic surveillance could be used to specifically, literally target dissidents in the future.
I actually write about that. In my article, Medical Surveillance Part 2, the subtitle is It Leads to Death by Drone Strike Really Fast. Because they're getting your genomic information, they're getting your genetic information, they're getting your personal information, your location information, and they've documented, there's peer-reviewed science published from healthcare institutions that say we're investigating the Internet of Drones. And one of the things about the Stargate project is using drones to deliver different countermeasures. It's in various articles, various different places that they've considered, and this is our government, healthcare regulatory agencies that are all cited in my article. I can't think of all of them off the top of my head because there's even more than I cited. But they're talking about how to deploy vaccines via drone. And now they're talking about it as in, we're going to load up vaccines and other countermeasures to areas that have trouble getting it, as if people really want the vaccine and they're having trouble getting it, which has always been the Gates Foundation and Melinda Gates. I've heard that out of her mouth like 100 million times, which I don't believe for a second. I think it's just targeting people and saying it to make it sound nice. But they're getting that information and they're saying, we want to deliver like our countermeasures via drone just in a package. But when you look at the documentation of how they can use drones and the fact that the government already has something called LMAMs, they even have like a acronym for these autonomous killer drones. They're called LMAMs, and they've already signed billions of dollars worth of contracts to make them. So they already have these in their arsenal. And these LMAMs, they might deliver deadly payloads like what we're seeing in Gaza and Palestine, because this same Palantir program, Gotham AI kill chain, is being used to target Hamas in Gaza and Palestine. So that's already been happening. And they already have the technology here in America. They've already used the Tiberius and Gotham AI kill chain in America to create a risk score and then detonate the countermeasure. So, all of the technology is in place. All of the databases are there. It's really just a matter of deciding, okay, well, now's the false flag. We're ready to go. It's really, I don't even want to be alarmist about it, but it really is that imminent. Unfortunately, I wished as I was writing the article, I really wish this is way off in the future and some sci-fi, this couldn't possibly happen. But they've been writing about this for so many years. And when they write that they're going to do something like this and they have all the technology available, history has shown they can't keep their finger off the button. So I don't really trust them at this point.
Yeah. Good point. And alarmism is only a bad thing when you're ringing the alarm about something that doesn't exist or isn't really a threat. But when you're on the deck of the Titanic that's going down and you're ringing the alarm, that's a good thing. So I think we need to be doing that. Obviously, these are incredibly important concerns that you're raising. And I don't blame you for not being able to remember every agency and connection off the top of your head, because for people who actually go through and read these articles, incredibly thoroughly sourced articles with lots and lots of links to lots more information for people to explore. It could take someone a long time to even just go through these two articles that we're specifically talking about today, let alone all of the other data that feeds into this that you, of course, have written about in your book. Speaking of which, tell us about the COVID code and what you cover in there.
Yes. So the COVID code, My Life in the Thrill Kill Medical Cult, it's a book that I wrote personally. I didn't ghostwrite it. I just, I felt compelled because it's basically my whistleblower account. It's what I witnessed at the beginning of COVID, all of the fraud, the regulatory fraud that I uncovered early on that let me know this is not a true pandemic. All the testing fraud, it covers the PCR issue. Later on, it leads to some of the key players like Datavant and Palantir that are involved in all this genetic surveillance and how that comes together and why. It goes into the history of where the codes come from, because I needed to know as I was, I guess, the reason why I couldn't continue my job, why I'm not working in healthcare anymore, why I wrote the book, was in April 2021, I could already tell that the vaccine, COVID mRNA vaccine, was the worst vaccine compared to all the other ones combined. And I had never questioned vaccines before. I literally woke up during 2020 and started looking into this because of how fraudulent and how obvious everything was going on. And I had a crisis of conscience because it was my job to label all the patients as COVID and get the hospital the bonuses. And then it was supposed to be my job to monitor the safety of the COVID mRNA shots by assigning adverse event codes or documenting death as a result of the vaccine. However, there was no code, no way to report that someone had died of the COVID-19 shot for over a year. So I felt like this is being deliberately buried and it's happening through the codes. So who is doing it? And I say who intentionally because it is the WHO who owns the codes. And when you look into their connections and their motivations, and it leads to an incredible array of every regulatory agency in America, as well as I could have gone on for years and years. Actually, I had to stop at a certain point, but it takes you down about 100 years of history to where the WHO began and their root in eugenics. And it begins to explain why all of this is happening.
And as people who have watched Who is Bill Gates, for example, will know, of course, Bill Gates was one of the largest single funders of the WHO and has his own interesting eugenics connections. And of course, as you say, the WHO as the head or seat of or connecting point of so many of these different regulatory agencies and foundations and other entities that are behind this agenda is an interesting point because, as people may or may not know, my channel was completely deleted from YouTube as a result of me daring to question the WHO and its health pronouncements during the depths of the scamdemic. And now YouTube has decided, since the political winds have changed, they've decided to let me back on YouTube. We'll see if this particular conversation is allowed to exist on YouTube today and what that may or may not say about maybe the data that is being collected through these AI systems about what people are saying and what kind of target score they should assign to someone like James Corbett or Zowe Smith. At any rate, this is the world that we're stepping into. As I say, alarmism isn't a bad thing if there is a genuine threat and emergency going on, and I would say that is exactly what this constitutes. So I hope people will look into these articles very specifically on medical surveillance. Obviously, they will be linked up in the show notes for this interview if you need it. Zowe is at zowe.substack.com. And what is the website where people can get your book?
The website is thrillkillmedicalcult.com. It's the only place where you can get the book in print. And it does support me more than if you go to Amazon. I'm working on getting it on Amazon, but I just got a proof today that didn't work. It didn't look like that. So going to be a little bit longer, but you can get the ebook on Amazon. And if you'd like it in print international, go to eBay. It is listed on eBay.
All right, Zoe Smith, we have only just scratched the surface of this information today, so I hope we'll have the opportunity to connect again in the future and go over more aspects of this. But thank you for bringing it to our attention, and thank you for doing this work. This is, as I say, you have an interesting perspective on this that a lot of people don't have, so I appreciate you bringing this information to our attention.
Thank you so much, James. Would love to come back and talk again.